Well, when this hit, as you mentioned, so many weeks ago here in Kansas, we were looking at how quickly we might be dealing with a local situation here. So we took literally dozens of measures here at Irwin Army Community Hospital in concert with 1st Infantry Division under the leadership of Major General Kolashevsky in Fort Riley, as well as in concert with our network healthcare partners. Those measures include some very simple yet effective things in terms of protecting and preventing, which is reducing the number of entrances to the hospital, instituting screening of all patients and staff that come through those entrances, including with verbal questions as well as temperature screenings, instituting hand washing stations and a requirement to use those before entering the facility. We also realized very early on that those patients that were calling the TRICARE line with questions or concerns related to COVID-19, that line was quickly getting overrun and overwhelmed because everybody across the country was utilizing that line. So we instituted an internal line that's staffed by IACH nurses, and it has been quite effective in reducing the wait times for our patients, because we were getting reports of 2 or 3 hours online waiting on hold. So one of the other actions that we took that's been very successful is we consolidated our pharmacy services, realizing that we needed more staff in one location in order to continue to provide the high volume of pharmacy services that IACH provides every day. So we consolidated our PX pharmacy team onto the hospital, and we established a curbside pharmacy service that's, again, has been very successful, now seeing between 250 and 350 cars a day. Approximately 75 to 80% of our pharmacy service is now delivered curbside. And again, that goes back to protecting and preventing. It protects our patients, our staff, and our facility itself, and prevents the unnecessary exposure and potential spread of COVID-19 to other patients and staff, again, preventing them from having to come into the facility just for a routine pharmaceutical pickup. We're very much dependent on our local network partners, but we understand at the same time, if this local community does see a surge in COVID-19 patients, that normal mechanism of referring to our partners might not be available. They might be just as busy, if not busier, than we are caring for patients. So we need to be ready. And we've taken a number of steps to be ready. First, training. Irwin Army Community Hospital doesn't routinely see high acuity critical care patients. We have staff members that are trained in that have experience in that, but maybe it's been a while. So we've implemented a training program across Irwin Army Community Hospital, and including 1st Infantry Division providers and medics, to ensure that everyone is brought up to the maximum level of their licensure and capabilities in order to be prepared for that possible surge of patients, specifically caring for critical care patients, which is different than your routine inpatient. We're talking ventilator management, management of blood gases, management of tube feedings, things that maybe it's been a few years since our team members have dealt with immediately. And so we've trained the team and cross-trained the team to ensure that we are ready in that respect. We also looked at how we might change our facility in order, again, to protect and prevent while we're preserving life, while we're caring for COVID patients. How do we continue to protect and prevent further spread and possible contamination of the rest of our facility? So our emergency department, for instance, is split into a red and green side. Red would be our COVID or COVID-related patients, and green would be those patients that still require emergency care but are not affected by COVID. Likewise, on our medical surgical floor, we have partitioned part of the ward specifically to care for, be prepared to care for COVID-19 patients. And so those structural changes that we've taken are another effort to protect and prevent, while at the same time providing the care that those patients are going to need. Likewise, to be ready for any eventuality, we've also established at one of our outlying clinics what we call a Role 2 capability, or a temporary patient hold or observation capability. In the event that Irwin Army Community Hospital saw a large number of cases and needed a place to observe patients that perhaps didn't need the critical care observation or medical care required, they would still have a place where we could closely observe them and monitor them to make sure that they were on the road to recovery before discharging them home. So part of our overall training program that we established to train and cross-train our own team included the providers and, more to your question, 68 Whiskey combat medics from the 1st Infantry Division. Our 68 Whiskeys are very highly trained medics and are very acutely able to care for trauma patients downrange and to stabilize and even hold those patients for a period of time. So we brought them in and provided some cross-training in terms of how you might have to care for a critically ill patient. Because trauma is one thing, but the critically ill patient that has the kind of ventilator management and other medical conditions as a COVID-19 patient might is something a little different. So we wanted to ensure that we not only leveraged their skills and abilities, but also brought them in as part of the overall medical team. So they have skills such as suturing, intubation, drawing labs, and the like. And we wanted to make sure that we maximized their potential as critical enablers to our overall mission to care for any COVID-19 patients that we might see. I'll say that it's been nothing short of incredible to see how this team, in concert with all of Fort Riley and our network partners, has consolidated around this challenge and has brought their experience, their knowledge, their subject matter expertise to bear on a very, what we call VUCA challenge. It's volatile, uncertain, complex, and ambiguous. And those types of problems are not easily solved. And there isn't always just one solution. So it takes a very much a collaborative approach of the team. It takes a team that is willing to listen to others on the team and not take the position that you have all the answers, because none of us have all the answers. We could make all the best training plans and facility plans, but if you don't have the people, those plans, you can't execute them. And I can tell you that at Irwin Army Community Hospital, we have got some incredible people that have, on very short or no notice, instituted things like our nurse advice line, instituted new capabilities like our drive-through specimen collection or our curbside pharmacy service, or begun screening patients and staff as they enter the facility. And every day I've gotten to see more and more of that innovation, that professionalism, and willingness to serve, and the desire to do right by our patients as well as our staff. And the letters outside aren't just there to look pretty. It is truly a sentiment that is true here. That is, that heroes work here. Heroes that their typical mission is not necessarily battling COVID-19. It might be preparing for the next conflict and how we take care of soldiers and families. But they have rallied around this, and they have done just outstanding, excellent work. I couldn't be prouder to be a part of this team.